So, what is integrative medicine? The Academic Consortium for Integrative Medicine and Health has developed the following definition. Quote, integrative medicine and health reaffirms the importance of the relationship between the practitioner and the patient. It focuses on the whole person, is informed by evidence-based science, and makes use of all appropriate therapeutic and lifestyle approaches, healthcare, and disciplines to achieve optimal health and healing. That's the official definition. Advocates say that integrative medicine is not the same as complementary and alternative medicine, and the acronym for that is CAM. Nor is it simply the combination of conventional medicine with complementary and alternative medicine. They say instead that it, quote, emphasizes wellness and healing of the entire person, biological, psychological, sociological, and spiritual dimensions as the primary goal, drawing on both conventional and CAM approaches, that's complementary and alternative medicine approaches, in the context of a supportive and effective patient-physician relationship. So I'm just going to make a brief comment on that. So since being in private practice for more than 22 years, I've seen that there's an evolution to the path that leads us as a culture to the idea of integrative medicine. In the 60s to the 80s, there was a strong movement worldwide to seek out, quote, alternative medicine. This was a separate and different way of looking at the body, supporting its natural expressions and processes. Alternative medicine at that time included Ayurvedic medicine, Chinese medicine, acupuncture, which is a part of Chinese medicine, naturopathic medicine, homeopathic medicine, chiropractic medicine, herbal medicine, and later saunas and other kinds of manual therapies that evolved during that time. Then in the 80s to 90s, I would say, was the birth of this concept of mind-body medicine. And you might know Deepak Chopra, and he kind of emerged as a very charismatic figure promoting mind-body medicine. And I will include a link to him as well. Some other leaders in this field besides Deepak Chopra are James Oshman, who wrote the book called Energy Medicine, The Scientific Basis, Richard Gerber, who wrote the book Vibrational Medicine, the #1 handbook of subtle energy therapies, and Candace Pert, who wrote the book called Molecules of Emotion, The Science Behind Mind-Body Medicine. And many other people have made significant contributions to this field of mind-body medicine. In the meantime, Andrew Weil became the face of MD turned towards natural medicine and therapies. And he later started a training program in Arizona for other MDs that were primarily interested in wanting to explore this trend and incorporate it into their practice. At this point, the MDs did not then want to be separate and distinctive like alternative medicine was perceived. So they came up with a new term called complementary medicine, and that emerged in the language of the natural medicine trends. Still distinct, but a complement to the traditional Western allopathic medicine, which they refer to as conventional medicine, which was firmly established in our culture at that time. A complement to the Western medical approach, but not a competitor. A more friendly natural medicine than the previous alternative, which was indicating that one was fed up with the regular conventional Western medicine approaches. And as a matter of fact, I received my PhD doctoral degree from the American University of Complementary Medicine in Los Angeles. And I think if that university were established today, it would likely name itself the American University of Integrative Medicine. So, which leads us back to this idea of integrative medicine. So, even complementary medicine became too threatening to the established medical world, and gradually our language shifted again to reflect a combined approach to healing using all available methods, integrated in a customized treatment plan to serve the healing of each patient, which of course Chinese medicine has been doing for the last 5,000 years. But in all fairness, Chinese medicine has not incorporated surgery or pharmaceutical drugs. Pharmacologically, we use herbs as our pharmacological base, but pharmacology from a laboratory setting is not something that we're trained to do. So in my opinion, this has been our culture's journey with finding a more natural approach to healing and turning towards it, away from one and towards the other. That would be the alternative terminology. Then using this natural approach in conjunction with Western allopathic medicine approaches, and that would be complementary, and then synthesizing an approach that is the combination of everything available in a good relationship with your practitioner and patient, and then customizing the treatment. So that's integrative medicine. So there's been a similar trend in the environmental movement from the early 60s until now that reflects many of the same stages. The establishment of the EPA, the Environmental Protection Agency, and CAM, the Complementary and Alternative Medicine Office, which is a branch of the NIH, the National Institute of Health, have very similar parallel tracks in terms of the evolution in that way. So I would be interested in any comments that you have, and you can post those comments in the section below this. So now I'm going to go into a little bit more depth about functional medicine. So what is functional medicine? Functional medicine addresses the underlying causes of disease using a systems-oriented approach and engaging both the patient and practitioner in the therapeutic relationship. It is an evolution in the practice of medicine that better addresses the healthcare needs in the 21st century. By shifting the traditional disease-centered focus of standard medical practice to a more patient-centered approach, functional medicine then addresses the whole person and not just an isolated set of symptoms. Functional medicine practitioners spend time with their patients, they listen to their full health histories, and they look at the interactions among genetic, environmental, and lifestyle factors that can influence long-term health care and complex chronic disease patterns. In this way, functional medicine supports the unique expression of health and vitality for each individual. So, how does functional medicine change the way we do medicine in this country? Well, functional medicine offers a powerful new operating system and a clinical model for assessment, treatment, and prevention of chronic disease to replace the outdated acute care model carried forward from the 20th century. And functional medicine incorporates the latest genetic and science systems biology and the understanding of how environmental and lifestyle factors influence the emergence and progression of disease. And lastly, functional medicine enables physicians and patients and other healthcare practitioners to practice proactive, predictive, personalized medicine and empowers the patient to take on an active role in their own health care. See more in the show notes that I'll list at www.functionalmedicine.org. So then, using blood testing, saliva testing, urine testing, and stool sample testing, functional medicine specialists find a unique way to bring your body back into a state of dynamic self-regulation. We look at optimal ranges for biosampling instead of standard ranges, which are narrower ranges where the health is optimal, not just normal, which is, or standard, which are broader ranges, but we bring that into a narrower optimal health range, and we try to get the patient to be within those numbers. So I'm interested in your questions about this, and you can post them below. I'd like to just introduce Chinese medicine because that's a long conversation, and that will take many episodes in order to explain. But I would just like to introduce a basic idea about Chinese medicine. It's a 5,000-year-old empirically based medicine. So empirical means that you obtain repeatable results through observation. So empirical evidence is the evidence that something is repeatable in each person over, many trials. But it's not a controlled clinical trial or a randomized clinical trial. So that's just the difference between empirical and what we consider to be the scientific standard now. So empirical-based medicine, that is the oldest medicine body of knowledge in the world today. It is based on the philosophy of Taoism, a philosophy that observes the natural world and then attempts to bring man into harmony with the natural order of the universe. TCM stands for Traditional Chinese Medicine, and that was established in the 50s. CCM is classical Chinese medicine, and that is based on the classics, meaning the classical texts that exist in Chinese medicine. So that would be the Neijing and the Nanjing and the four great masters and the Shan Han tradition. So all of these are the classics. And we'll cover those in future series. And then there's the family traditions, which have been passed down from father to son. And an example of that is the Master Dong tradition, which has been taught throughout the United States by Richard Tan, who is no longer with us. And Susan Johnson is here in the Northern California region. And so they both practice that medicine in their private practice, and they teach that medicine to other practitioners that want to learn that tradition. So acupuncture is one of the mainstays of Chinese medicine, and herbal medicine is the other mainstay. So those are the two anchors of Chinese medicine. And then there's a lot of other things that are considered to be Chinese medicine techniques or therapies. And so I'm just going to give you a rundown of that. Any other meridian-based therapy which restores the free flow of qi, or vital energy or life force, in the highways of your body's lifelines, which are called the meridians. So that would include acupressure, reflexology, Tui Na, Jinshin Do, Shiatsu, Gua Sha, cupping, moxibustion, magnetic therapy, vicarious seed pressure, and electrical stimulation, or e-stim. That could also include a TENS machine or many other terminologies for that. And, of course, Chinese herbal medicine, which I mentioned, and other plant medicines that can be incorporated into Chinese medicine are aromatherapy, because many of the Chinese herbs are aromatic, and so now they're being distilled into essential oils. And even